Hello everyone, I am Dr. Sunil, PGI HPB and multi-organ transplant surgeon. I am one of the chief editor for DigiNerve Surgery SS. So today we have Dr. Tanishk with us. He is a top ranker from recently concluded NEET SS examination. He has obtained rank 10. So he has done his UG from MGM Medical College Indore, and then he has done his post graduation in general surgery from PGI Chandigarh, and I am also alumnus of PGI Chandigarh. I did my MS MCH from the same place. So welcome Tanish. So how does it feel now? You have got your dream rank. So how do you feel?
First of all, thank you, sir. Thank you for your kind introduction. Uh, I'm feeling good because it is beyond my expectation. I was not expecting rank 10. So it's overwhelming, and I'm happy that I got such a good rank.
Okay, congratulations. And then, how did you come to know that you got rank 10? No, how was your initial response? Who was with you? You were alone, or somebody called and told you? How was it?
Actually, I was at home and I came to know that results are out. So I kept myself alone actually, voluntarily, and I saw my result by myself. Then I rechecked it again and again that yes, I myself got rank 10, and then I informed my mother and my father. It's like that, sir. It was like that.
Yeah,
So
I
I
think.
came to know my rank by myself only.
Okay. No, I think
So
it's
I,
a
but
very
I
much
rechecked it again
special.
and again.
Yeah, it's a special moment. I can understand. So,
Yes, sir. It was very
what will be
special.
your choice now? You have got a very
Yes, sir.
good rank. I think you're going to get everything, whatever you want. So, what you're going to choose now?
My choice would always be GI and HPB surgery, sir, because
Okay, okay.
as you told, you are also alumnus of PGI, and our training in MS in general surgery is more towards GI and HPB only. So it looks very fascinating also. So during our training session also, we were exposed more towards the GI cases and HPB cases. So I developed interest in that only. So I will choose GI and HPB as my career.
I can
Yes.
correlate. So congratulations again. So I'm going to ask you some general questions so that people can benefit with your experience with respect to preparation for NEET SS. So firstly, can you tell me in brief what was your overall preparation
Sure, sir.
strategy?
Actually, I had completed my MS in September 2025. So I had 2 months to prepare for NEET and INI-SS. Previously, NEET was scheduled on 7th of November 2025, sir. Later, it got postponed. So I started my preparation as per the NEET because we had some exposure of GS and GI surgery, but very less exposure and knowledge about the subjects like plastic surgery, neurosurgery, CTVS, all the subspecialties, super specialties. Then the NEET got postponed. So I had to face INISS first. So I switched over my preparation towards the GI and HPV surgery. So in 2 months, I covered video lectures of GI and SPB surgeries and all the super specialty subjects, including general surgery. Simultaneously, I did Q banks, and in every week, I used to give a grand test, sir, to assess myself that where I'm standing, I'm doing good or not, to see my progress basically. So I had 2 months to prepare for NEET SS as well as INI-SS. In that 2 months, I prepared.
Okay. Yeah,
Yes,
I
sir.
think that's very encouraging for many students. No, many people are worried that you cannot crack examination in the first attempt. You have
Yes,
cracked the examination like within 2 months. So
yes.
probably I think you were kind of preparing for last 3 years, not just 2 months. Maybe you kind of did a brush up for last 2 3 months, but you were like reading throughout your MS surgery or something or other. No, trying to clear your concept. What do you think?
So you can understand me better that in PGI we have to work for all 3 years. We have very less amount of time to study.
I
It's
understand
not
that.
like other countries where second, third year residents get time to study. So honestly, I had no time to study. Yes, but I would say in last 3 4 months, which we got for our MS exam, I read Sebastian and Bailey, but did not read
Okay.
Bloomgard's or Shacklefold. Few topics we read, just like short bowel syndrome from Shacklefold or the few liver trauma from Bloomgard, but not cover to cover. So in last 2 months, yes, I had some command over GI and GS surgery because of our training, but not according to the MCQs or like that competitive exam per se. We had background knowledge, but yes, I had to practice MCQs and brush up my knowledge. So in last 2 months, I did that only. But it's not like that. I was reading for last 3 years. I read for 3 4 months only in my during my residency period for just to get passed in MS exam.
That is in fact more encouraging. People who think that they need to prepare a lot. With your own experience, no, people even if they have 2 3 months and if they do a focused preparation, and if they have done good work during their residency, if they have done good work, they are involved in
Yes, yes,
their training, and they know what they are doing. Probably they will do well in NEET SS examination. So I think you have
yes.
gone through our app, DigiNerve app Surgery SS. So how did you find it? No, is it good, or how can it help students? What do you think about our app, DigiNerve app?
Actually, I found it very structured. Did you know? There is a separate section for the instruments and tools. There are separate section for all the specialty subjects. Also, the grand test section, it was already mentioned that it is easy, it is moderate, so that we can assess ourselves in a better way. Also, there is a Dr. Wise, that chatbot, and the beautiful use of the artificial intelligence. I don't think any other platform is having such kind of function in their app that we type a query or a question and instantly it answered with the reference of the standard textbooks. So I found it very structured and useful. Also, the Q banks. However, I could not solve all the questions, but I took a trial for 5 days and I found it very helpful and structured. It is different from other apps in the way it is structured.
Thank you. So all of us have put lot of effort in preparing lectures, preparing question banks, like the instruments. All those
Yes,
things
sir.
we have put lot of effort,
Yes,
and I am happy that you liked it. So with respect to
yes,
see, it has every app has irrespective of whatever you are using, it will have QBank, it will have lecture notes, it will have videos, lecture videos. Then you also have textbooks. So all the students now who are going to prepare for NEET SS for the next year, so how do you like which ones are must, which one are desirable? Like, do they need to read textbooks? Do they need to watch videos? You told question bank. No, how many questions they have to solve? How frequently they have to solve? So can you tell us a strategy what you followed?
First of all, there is a question from a lot of students that whether we have to read the standard textbooks for the preparation. So I would say read Sebastian and Bailey at least during your NS preparation. When you start preparing for the NEET or INI-SS and you have a little amount of time like 2 months, 3 months, so first complete all the videos and simultaneously do the Q banks. Then, if you have a time, so you can refer to the standard textbooks, but do not skip the videos because uh, videos are amalgam of all the standard textbooks as well as previous year questions. So in little amount of time, you can cover majority of the chunk or the chunk of the content, which you cannot memorize by reading the textbooks. But if you have a time of 1 year or let's suppose 6 months, 7 months, then you can start reading textbooks also. I had 2 months only, so I could not read a standard textbook. I just watched the videos, did the Q banks, and also the grand test every week.
Okay. So that makes sense. So, see,
Yes,
whenever we are preparing video lectures, we go through all the textbooks.
all
We
the
know
time.
what are the previous questions, no, and then I
Yes,
discuss about everything when I am talking about a particular topic. So that makes sense. So other thing is,
Yes.
see, you had gone through the lectures, you have solved the questions. So when you really gave the exam, did the exam and whatever
Yes,
you
sir.
prepared, like the previous questions and all those things, was it the real reflection, or like you prepared very high and then the questions came very easy, or it was like almost same? Your preparation and what you got in the exam was at the same level. How, what was your experience with that?
Sir, I gave both INI-SS and NEET SS this year, and I got rank 10 in both the exams. So
Okay.
I would say both the exams were according to my preparation, not above that, not below that. So what I was getting in the grand test marks in my NEET SS or INI-SS, two, three questions maybe ऊपर नीचे हो सकता है. But yes, it was the reflection. The exam was the reflection of the Q banks which I used to solve during my preparation. The difficulty level, also the pattern of Q bank, that how the questions are set in the Q bank. So and also it is like that in main exams the questions are not that tricky, which we used to solve in our Q bank, because they are not professional question bank setters. So the original the INI-SS or the NEET SS exams, the questions were mostly like I would say like it's not that much tricky, or they are सीधा सीधा questions, इतना ज्यादा tricky नहीं था sir. But the difficulty
Okay.
level, I would say it was same, not above that, not below that. And in
So,
NEET SS also there were 150 questions, 10 to 15 questions will always be like that, that the difficulty level would be above and no one knows what would be the exact answer of that question. But it would be same
okay.
for every student.
So how will
Yes.
you, like for example, if you have to prepare and you have 30 days now for the examination, how much time you will devote
30
to listening to videos, and how much questions every day you will solve? Like, is there anything like you will suggest to the students?
Sir, in last 30 days, I would prefer to revise instead of watching videos. In initial
Okay.
30 or 35 days, I would watch the videos, and then in last 30 days, I would revise. My main focus would be on revision, and the around 120 questions per day should be the target. In
Okay.
last 30 days, at least 4 to 5 grand tests we should give.
So how do you
Yes.
revise? Like you make notes or you refer to notes from us, whatever we gave? Like what is the strategy for revision?
So I did not make my own notes. So I read from the notes that is given in the app, that the digital
Okay.
notes. So I read from that only. Yes, sir.
Okay.
And then yes, one more thing I want to add, sir. Giving the grand test is not sufficient. We have to give time to see all the descriptions that is given in the answers. So that actually brush up the knowledge. So just giving the grand test, seeing the results and leave it, it's is not sufficient.
You
Yes,
have to read the explanation and know
yes,
why this is the right option and why others are the wrong
yes,
option. Yeah.
yes, sir, yes.
So, any other advice you want to give to the NEET aspirants? No, whatever. Like you might have done some mistakes, and probably if you'd have done it in a different way, the results would have been like still better. So, any advice you want to give it to students now who are preparing for next year?
Start reading during your residency period if you are getting time, which I could not do. So that is the first thing. Also, do not escape from your ward duties or the OTs just to read the textbooks. Some people they miss OTs or the ward works just to read the textbooks. That is not the good thing. Gain clinical knowledge, attend all the OPDs, OTs, all the ward works, and then if you are getting time, do not waste it. Start reading textbooks, not according to the NEET SS or the INI-SS, but just to build the background knowledge. And then in last 2 3 months, you can easily brush up that knowledge and prepare according to the MCQs. So if during your residency period, start reading standard textbooks, at least Sebiston. Sebiston is very good book, I would say. And every question, even in INISS, they are taking it from the Sebiston only.
Yeah, and that is the standard textbook most of us read. during our MS days. What is the trend is like people for UG
Yes, sir.
people
Yes.
read Bailey and Law, and for MS surgery we generally use Savista. That
PG
has been trend in most of the
Sebastian.
places.
Yes, sir.
Yeah, and of course in PGI we read Savista.
Yes.
All of us read Savista. Yeah.
Sebastian, sir.
Yeah.
Yes, sir.
So what you are saying is to focus on clinical work rather than reading, like skipping work and reading, because that makes sense. Most of the questions which are being asked in the NEET SS are clinically relevant. Nobody is going to ask you question
Definitely.
like out of the blue. Most of them,
Yes.
like whatever you have seen or what you are practicing, the questions will be related to that.
Yes, sir.
So, for example, if you see
Yes, sir.
patients of carcinoma gallbladder, you do a pre-op
Yes,
evaluation
sir.
and then you participate in the surgery, and then you read about it, and
Yes, sir.
same thing will come in the examination. So that's the
Yes,
right way,
definitely, sir.
like right way of approaching the subject rather than just sitting and reading and not going to the hospital. So I think that's what you want
Taking
to
it in.
tell everyone. Anything else with respect to, see, you want to do GI surgery? Anything else after that? Like now, GI surgery, HPB surgery is a huge branch. So, you have any particular interest in subspecialty of GI surgery, HPB surgery?
Sir, I have not decided it yet.
Okay.
Uh, I want to do GI and HPB as a whole, not just HPB or not just hollow viscous. So, as of now, I want to do both. Then I will decide that if I want to do core HPB only or liver transplant or something like that. So, I will
Okay,
decide
let's.
according to where I will or do the practice or where I need to settle. So, according to the demand and the interest, I will decide. As of now, I have not decided it yet.
Nowadays, in GI surgery, we have transplant and then GHPV surgery, no transplant, then you have bariatric, then we have advanced minimally invasive surgery. So,
Yes,
but
sir.
anyway, I think with time, no, once you get into residency, you will make up your mind. So, what really interests you?
Yes, sir.
So, I can
Yes, sir.
understand that. So,
Yeah.
now, like you have used our app, DigiNerve app. So, do you recommend our course to your juniors or your colleagues who are going to prepare for NEET SS again? And if yes, then what do you think? Why our app is having an edge compared to other apps?
Definitely, sir. I would suggest the DigiNerve for my juniors also during their MS exams because in your app, in the DigiNerve app, there is a separate section for the long case and short case that is very important for the practical exam. So also surgical instrument part that I had already mentioned, and the separate video lectures for general surgery, basic concepts, clinical audits, and the then definitely the GI surgery, plastic surgery, all that. So I would recommend this app to my juniors, even during their MS exams, to gain the knowledge and build the clinical knowledge. So it will help both in MS exams and the competitive exams like NEET SS or INI-SS.
Thank you. If you are using Dr. Wise, no, whenever you put a particular topic, it will also provide you a link for the lecture on that. Dr. Wise will provide even the, like, you can access the lecture also, because we have covered everything.
Yes,
Even you will find lectures on each and every topic. If you put any particular topic apart from the theory part, like notes and book chapters, it will also provide you a link for the lecture so that you can directly reach the lecture and listen to it. Dr. Wise.
okay.
And Dr. Wise, no, if you want any MCQs on a particular topic, you ask it to give you five MCQs on a particular topic. It will automatically generate five MCQs or 10 MCQs or 15 MCQs, and then you can solve it, and it also gives you explanation. So that's the beauty of Dr. Wise, no?
Yes, I think that's a noise thing. I don't think so. Any other app is have these facilities.
Yeah.
It's new for all of us.
So, all right, Dr. Tanishk, it was nice talking to you. I wish you a lot of good luck. I'm sure you will do well in your GI surgery, HBB surgery residency, and then you will do well in your career. So, if you have any questions, always feel free to reach out to me. You have a lot of good people, no, everywhere. I know that you are doing GI surgery, and everybody will help you if you like. But if you want any particular thing, always try to get in touch with me. I'll be happy to help you. Okay.
Thank you so much, sir. Thank you so much. So kind of you, sir.
Thank you. Have a good day. Yeah.
Thank
Bye.
you.